guys, and welcome back to my channel. In this video we are going to talk about lateral sclerosis, multiple sclerosis, syringomyelia, multiple myeloma, hemorrhagic vasculitis and Scombrotoxicosis. So we are going to see what are the questions related to these topics are highlighted in the croc exam. So let's start. Let's start with the amyotrophic lateral sclerosis. So I have included all of the topics in the single photo itself because there is only one question on each topic. So I have included the full photo in one page itself so that you can take a screenshot and remember it very well for the long-term memories. So let's see what is lateral sclerosis. So lateral sclerosis is a progressive neurodegenerative disorder which is affecting the upper motor neuron and lower motor neuron. So you can see the symptoms here, and the symptoms are limb weakness, the muscle hypertrophy, fasciculations, muscle strength is weak, muscle weakness, and Babinski sign will be positive. So no sensory loss and no coordination loss. So this is something which will be highlighted in the croc question. So since it is a motor disease, so there will be no sensory problem. As you can see in the question, the keyword is screaming right now that there is no sensory disorder. So as let's read the case, that 67-year-old woman complains of the weakness in the arm, heaviness in the legs, twitching muscle in her limbs, marked hypertrophy in the arm limbs as well, and diffuse muscle fasciculation in her limbs, mainly in the arms. Muscle strength decreases. However, muscle strength decreases in all the neurodegenerative disorders. So Babinski is positive. So this is the main thing which I highlighted in the question, that there is no sensory or coordination disorder detected in the question. So this is lateral sclerosis. Remember the case, take a screenshot, and let's go next. Next is multiple sclerosis. So multiple sclerosis is a autoimmune disease affecting the CNS, where the immune system attack the myelin sheath, leading to the demyelination and neurodegeneration. So the symptoms, let's say this time we are having the problem with the CNS. So this time the problem is sensory. So let's only highlight the main key points from the symptoms. That the horizontal nystagmus is some of the common findings. So as you can see that there is sensory problem. So now the sensory reflex is not coming to the legs, so the person will feel lack of coordination and impaired balance, which is given in the question also. The patient is walking unsteady. So optic finding are some of the hallmark findings, that temporal pallor of the optic disc, optic neuritis. Since the muscle of the eye or the neural supply of the muscle is very small in size for the eye, so if there is an even the mild problem with the CNS, the problem is going to get very severe for the eye or optic system. So this is something a hallmark for the multiple sclerosis, that there is temporal pallor of the disc, optic neuritis, and more symptoms we can see. Even ataxia is some of the hallmark finding for it. So ataxia is lack of coordination and impaired balance. So let's see the case finding. More symptoms, like I have told you, that muscle weakness will be, or progressive weakness will be there in these cases as well, like multiple sclerosis. So let's see the case study. After giving birth, 25-year-old woman developed increased weakness in the legs and unsteady walking, because the problem is sensory this time. So unsteady walking. So it is a seasonal problem for her. So objectively, horizontal nystagmus I want to highlight to you, that horizontal nystagmus is given. So it is hallmark finding for the multiple sclerosis, and ataxia, that she cannot coordinate anymore because of the sensory problem. So let's highlight it one more time. In the lateral sclerosis, the problem is with the motor neurons. So there is no sensory problem, as you can see in the question. So and in multiple sclerosis, there is problem with the sensory like CNS. So the sensory problem is there. So that's why the person cannot walk properly, and ataxia is there, so he cannot coordinate properly. All right. Next is syringomyelia. So syringomyelia is also a neurological condition where a fluid-filled cavity named syrinx forms within the spinal cord, or usually in the cervical neck region. So I will also throw a shot on YouTube about the syringomyelia profile, how the syrinx or the fluid-filled cavity will look like to you. Let's see the symptoms. The symptoms are loss of pain, thermal sensations, dissociated sensory loss. So as you can see, this is also a sensory problem because a syrinx is there, a fluid filled cavity is there, so it is interrupting the sensory system. muscle weakness is there, atrophy is there, upper motor neuron sign. I have told you that muscle weakness will be in all the neurodegenerative disorders, so upper motor neuron sign. So in this case a little bit difficult, or let's say a little bit different things are there from the lateral sclerosis or multiple sclerosis. So the reflexes will be decreased in the arm and increased in the legs. So this is something hallmark finding for the syringomyelia. So let's see the case study. A 42-year-old man complains of the lack of pains and thermal sensitivity in the left arm, his chest, which causes him to receive a burn that take a very long time to heal for him. So the patient did not notice that his hand is burning because he lost the sensitivity. So as you can see in the symptom portion, that there is sensory loss, the thermal sensation loss over there. Next is history. The symptoms started without any cause and have been increasing throughout the 5 years. Segmental dissociation, sensory disturbance in C3 to C7 segment of the left. So in the level C3 to T7, what is there? There is syrinx, which is causing all of this sensory problem, that the patient's hand got burnt and he did not even feel the pain. So remember that thermal sensation loss or loss of pain sensation is the case related to the syringomyelia. Let's go next. Next is multiple myeloma. So a very short explanation for multiple myeloma. It is a malignant tumor of the plasma cells in the bone marrow, leading to the overproduction of the monoclonal immunoglobulins. So there will be M protein deposits over there. So symptoms, let's see. Bone pain. Bone pain is something, the hallmark, which we are going to use in the croc question. Bone pain and Benz-Jones protein. Look at the symptoms and just remember about the bone pain and Benz-Jones protein in the urine, that these are the hallmark finding for the multiple myeloma. Let's see the case study. You can read the question, you can pause the video, you can take the screenshot as well. The 55-year-old man complains of the pain in sternum, lumbar spine and ribs. So as you can see, bone pain, where is it more common? Sternum, lumbar spine. So if the patient is just complaining about the pain in the bones. And in the urine findings, M protein deposits you can see in the question. In the urinary findings, they say Benz-Jones protein. So remember, the Benz-Jones proteins are a character of multiple myeloma. Next patient also complains about the pain in the bones. So remember about pain in the bone is the character of multiple myeloma. However, you can read the whole question. So let's go next. Next is hemorrhagic vasculitis, which is also known as Henoch-Schönlein purpura. So let's go next. Hemorrhagic vasculitis is small vessel vasculitis. So immune complex mediated small vessel vasculitis, mainly affecting the children, often after respiratory infection. So it will cause IgA immune deposition. Symptoms, let's say skin, joint and GI symptoms or kidney symptoms will be there, because it is affecting the small vessels. So kidney is having small vessels, so there will be kidney problems. GI, some of the GI parts are having small vessels, so they will be having GI problem. Let's see the case study. So the case says that disease onset was acute. A child developed general weakness, pain in the joints and fever. Later this was accompanied by the itching in the skin rash, manifested by erythematous spot of 2 to 5 mm in the size. The rash gradually turned hemorrhagic, and large joints are painful. Swollen pain attacks periodically occur in the periumbilical area. There are symptoms of intestinal hemorrhage. So we can see in the last line intestinal hemorrhage and periumbilical area. So GI symptoms are there, and the joint symptom are there. Large joint are painful and swollen, so the joint symptoms are there. And another thing which the question is saying, that disease onset was acute, pain in joints, and these signs were accompanied by the erythematous spots of 2 to 5 millimeter in the size. So when it is saying the skin symptom, GI symptom, as you know, all these symptoms will appear in the hemorrhagic vasculitis. So let's go next. Next is a question over Scombrotoxicosis. This is something new, which I also find something new just in recent days. So let's see the what is Scombrotoxicosis. So Scombrotoxicosis, what it is basically, it is a non-infectious foodborne illness caused by the infection the fish containing high level of histamine. Let's read it again. Scombrotoxicosis is a known infectious food-borne illness which is causing the ingestion of fish containing high levels of histamine. So the problem is with the histamine compounds, right? So let's see what are the symptoms we will be seeing in this one. So facial flushing, headache, nausea, vomit, abdominal cramps, diarrhea, metallic taste, palpitations however can be there or cannot be there, not necessarily, right? It's also Scombrotoxicosis is also known as histamine fish poisoning. Let's see the case study. So the patient has ate a batch of vacuum packed salted salmon. It has determined that the histamine level in this product are 2.8 times higher than the maximum permissible concentration type. So a type of food poisoning. So we know already in this question that there are if the patient ate the fish, the salmon fish, and histamine levels are in this product are 2.8 times higher. So the problem is with the histamine. When you do not remember any concept from me, just get back to the definition and you will be able to think better. As the definition says, it is the problem with the ingestion of the fish containing the high level of histamine. So this is the question is explaining it very well. So this is it with this video. I hope you enjoyed the video. See you in the next video.